Hi, I'm Chris Wade and I'm a consultant speech language therapist, and I'm going to talk about developmental language disorder. So developmental language disorder, which I'm going to refer to as DLD because it's a bit of a mouthful, is a speech, language and communication need that impacts on a child's understanding and use of language. And the kind of accepted term when there's a pre-existing diagnosis such as autism or a brain injury or Down syndrome, for example, is a language disorder in the context of the other diagnosis. So it would be a language disorder in the context of autism. So DLD itself manifests in kind of difficulties in following classroom instructions. So that might be difficulties with following particular concepts or remembering the whole instruction. It can present as difficulties in kind of learning new words and kind of using those words appropriately. It can manifest in the kind of a difficulty in putting sentences together, so age appropriate sentences, or maybe using correct grammar when a sentence is present. And what you can see is that if you consider the impact of all of the above, a developmental language disorder has can present as a child that has difficulties in kind of accessing the curriculum independently, making and maintaining friendships, and the ability to advocate for themselves. And like I said, this is the whistle-stop tour of DLD. There's a lot of information that's out there on DLD. And what I feel is kind of crucial when we consider the diagnosis of developmental language disorder is that the word disorder is present, and therefore if we consider it in comparison to a delay, so with a delay, it's expected the child will make, in a sense, spontaneously recover from the difficulties, and with a disorder it's accepted that direct intervention is required. So the type of children that I will see will most likely have already been seen by an educational psychologist. They may be kind of known within schools having particular difficulties, such as in maintaining friendships or in following instructions, for example. But the likelihood is they've not been seen for a thorough speech and language therapy assessment. And when I say thorough, the types of assessments that I'd be advocating for is, so from a dynamic assessment perspective, what I would typically do is I would observe the child. I'd get the communication children's checklist, Children's Communication Checklist 2, I mix them up all the time, so the CCC2, completed by both school and parents, and that looks at a bunch of kind of communicative behaviours and kind of gives us an indicator in terms of differential diagnosis between autism and DLD, or whether both can be present. I'd carry out an assessment such as the CEL-5, so the Clinical Evaluation of Language Fundamentals 5, or the preschool CELF, depending on what the age of the child. I'd gather language samples, I'd observe the child in at least one academic lesson and during break time, and then I'd meet with kind of teaching staff members and parents to look at what their overall concerns are. So it needs to, from my opinion, from my perspective, it needs to be a relatively thorough assessment to really work out what's happening. And my concern with language disorders and DLD in particular is that when a child already has a diagnosis such as autism or Down syndrome, the expectation is that they'll have difficulties with language, and therefore language disorders then aren't necessarily kind of investigated. So my advice is always to kind of, as a speech therapist, my advice is to kind of push for a thorough speech language assessment to really kind of look underneath the surface level and see exactly what's happening. So I hope that was helpful. It was a 4-minute or just over 4-minute whistle-stop tour on developmental language disorders. Thank you for your time.